There's an old expression used by many Hoosiers and others across America. It's time-tested. Your word is your bond. In Indiana, like so many other places across the country, we value honesty and good old-fashioned truth-telling, even if it hurts a little bit to hear the truth. Having spent the previous 4 days in Indiana listening to Hoosiers, it's clear that so many people in my state, and I think as I read nationwide, are pretty fed up with Washington right now, and they have reason to be. They're frustrated because promises that were made to them are being broken. Outright guarantees have been disregarded. President Obama, both before and after his signature legislation, now called Obamacare, passed, promised all Americans that they could keep their health insurance plans if they liked those plans. It was a promise repeated over and over again. For many Americans, it was the sole reason why they supported the Affordable Care Act, or so-called Affordable Care Act. But the President's guarantee, announced publicly by him several times, simply was not true. In recent months, millions of Americans have received notification that their plans are being canceled because of the Obamacare law. And reports indicate now that the White House has known this for over 3 years, that these cancellations were coming. So when the American people found out that the White House knew the bad news was coming all along, they were, to put it mildly, not happy. Now, it's clear even some of those who voted for Obamacare and continued to support it are now agreeing with the majority of Americans that the President's health care law simply is not working. One such member has floated the idea of having the Government Accountability Office and the Inspector General for the Department of Health and Human Services conduct, and I quote, a complete, thorough investigation to determine the causes of the design and implementation failures of healthcare.gov. Let me repeat that. A complete inspection and thorough examination, investigation about the design. So we're talking more here than just about a glitch in setting up the website. We're talking about the fundamental policies and provisions that undermine this law going forward. So fixing the website, if that happens, and can happen, and eventually I think would have to happen, that's not the real problem. The real problem here is a flawed design, or at least one Democrat's indication that this is there's a deep suspicion that there's more fundamentally wrong with this than just simply a glitch in the implementation. Two others have introduced a bill entitled, and I quote again the bill's name, Keeping the Affordable Care Act Promised. A House Democrat recently stated, and I quote, I think the President was grossly misleading to the American public when he promised Americans they could keep their health care coverage if they liked it. Now, even former President Bill Clinton has said that he thinks the President's pledge to allow Americans to keep their coverage should be honored. In an interview this week, former President Clinton said, and I quote, so I personally believe, even if it takes a change in the law, the President should honor the commitment that the federal government made to those people and let them keep what they got. This is growing admission from the supporters of Obamacare that we are dealing with more than just a website glitch. We are dealing with fundamental policy design flaws. And so I agree with President Clinton. Regardless of whether or not you support Obamacare, there should be 100% bipartisan support for letting Americans keep what they had been promised. That their existing health care insurance plans, if they like them, they can keep them. It's time to acknowledge, however, as Senate Minority Leader Mitch McConnell said yesterday, that it goes beyond this, that the Affordable Care Act is beyond repair. This disastrous law needs to be repealed and replaced with real reforms that drive down the cost of health care, increase the quality of care, and put the patients not Washington bureaucrats in charge of their health care decisions. Unfortunately, this president and Senate Democrats have made it clear they will never allow a repeal bill to pass despite all the broken promises to the American people and despite the fact that the law simply isn't working. It has serious design flaws. Now, given this reality, the appropriate step, I believe, and one with growing support, even bipartisan support, is for a one-year delay of the implementation of Obamacare. I have offered a bill to delay the Obamacare mandates on the individual side to join with the President's already made decision to have a one-year delay of the employer mandate so that all Americans can have the same relief, not just business, but individuals who are also subject to this law. By delaying the mandates, all the mandates in this health care law, we can give the American people a fundamental choice when they go to the polls in 2014. Continue Obamacare or replace it with sensible, affordable reforms that drive down the cost of care, increase the quality, and most important, put patients, not Washington bureaucrats, in control of their health care decisions and their health future. I would say this in closing, Mr. President, your word needs to be your bond. As Albert Einstein once said, whoever is careless with the truth in small matters cannot be trusted with important matters. Madam President, I yield the floor and note the absence of